Good morning, everyone. I am Indira Ranjini Roy. My roll number is 26, and today I'll be giving a brief insight on the topic social casework with victims of child abuse. Let's look into a brief introduction on what social casework is. Social casework is a fundamental component of the field of social work focused on helping individuals and families address a wide range of personal and social challenges. It is a client centered, strength based approach that aims to enhance the well being and functioning of individuals in need. Social casework practitioners engage with clients on one-on-one basis to assess their unique circumstances, identify underlying issues, and develop tailored intervention plans to facilitate positive change. The objectives of this presentation is to give an introduction on child abuse and an introduction on trauma-focused cognitive behavioral therapy and how effective TFCBT is with victims of child abuse. Here's an introduction on child abuse. Child abuse is any action, omission, or carelessness by a person, whether an adult or a child, that poses a serious risk to the life or development of a child. It has long lasting negative influence on their physical and psychological well being. Child abuse in all of its aspects is a global problem that has over time been greatly underappreciated and misunderstood. It is also quite common in India, where it is deeply ingrained in social, economic, and cultural traditions. Let's now look into the approach by which child abuse can be treated effectively via casework. The approach is known as trauma focused cognitive behavioral therapy, aka TFCBT. Trauma focused cognitive behavioral therapy addresses the mental health needs of children, adolescents, and families suffering from the destructive effects of early trauma. The treatment is particularly sensitive to the unique needs of youth with post traumatic stress and mood disorders resulting from sexual abuse as well as from physical abuse, violence, or grief. Because the client is usually a child, TFCBT often brings non offending parents or other caregivers into treatment and incorporates the principles of family therapy. The trauma focused approach to therapy was first developed in the 1990s by psychiatrist Judith Cohen and psychologist Esther Deblinger and Anthony Manarino, whose original intent was to better serve children and adolescents who had experienced sexual abuse. TFCBT has expanded over the years to include services for youths who have experienced many forms of severe trauma or abuse. TFCBT has been evaluated and refined during the past 30 years to help children and adolescents recover after trauma. It is a structured and short term treatment model which effectively improves a range of trauma related outcomes in 8 to 25 sessions with the child or adolescent and caregiver. All of the studies have documented that TFCBT was superior for improving children's trauma symptoms and responses. It has also effectively addressed many other impacts, including effective behavioral changes and disorders. Now, let's move on to the treatment and effectiveness of TFCBT. The treatment involves individual sessions with the child and parent separately and joint sessions with child and parent together. Each individual session is designed to build the therapeutic relationship while providing education, skills, and a safe environment in which to address and process traumatic memories. Joint parent-child sessions are designed to help parents and children practice and use the skills they learned and for the child to share their trauma narrative while also fostering more effective parent-child communication about the abuse and related issues. To date, at least 20 empirical investigations have been conducted evaluating the impact of TFCBT on children who have been victims of sexual abuse or other traumas. In addition, there have been studies specifically showing the effectiveness of TFCBT with children exposed to domestic violence. The findings consistently demonstrate TFCBT to be useful in reducing symptoms of PTSD, as well as symptoms of depression and behavioral difficulties in children who have experienced sexual abuse and other traumas. In randomized clinical trials comparing TFCBT to other tested models and services, TFCBT resulted in significantly greater gains in fewer clinical sessions. Follow-up studies have shown that these gains are sustained over time. Children showing improvement typically experience significantly fewer intrusive thoughts and avoidance behavior, and they are able to cope with reminders and associated emotions. They show reductions in depression, anxiety, dissociation, behavior problems, sexualized behavior, and trauma related shame. They demonstrate improved interpersonal trust and social competence. They also develop improved personal safety skills and become better prepared to cope with future trauma reminders. Research also demonstrates a positive treatment response for parents. In TFCBT studies, parents are often reported reductions in depression, emotional distress associated with the child's trauma, and PTSD symptoms. They also report enhanced ability to support their children. In conclusion, TFCBT is an evidence-based treatment approach for children who have experienced sexual abuse, exposure to domestic violence, or similar traumas. Despite the impressive level of empirical support for TFCBT and an established publication track record, many professionals remain unaware of its advantages, and many children and parents who could have benefit do not receive such treatment. Further, in many communities, there may not yet be any TFCBT trained therapist. The current demand for such evidence based treatments, however, will encourage other professionals to acquire the needed training and to implement the TFCBT model. Increased availability of TFCBT, along with increased awareness among communities, can offer significant results in helping children to process their trauma and overcome emotional and behavioral problems following sexual abuse and other childhood traumas. So that's all about social casework with victims of child abuse using trauma focused cognitive behavioral therapy. Thank you.